In a landmark move to address persistent challenges of drug shortages in public hospitals, Federal Ministry of Health and Social Welfare has officially launched its first ever digital procurement platform for essential medicines. The maiden initiative, unveiled at a formal ceremony in Abuja, marks a major step forward in modernizing the nation's healthcare supply chain and improving availability of critical medicines in tertiary and secondary health facilities. Speaking at the event, Permanent Secretary of the Federal Ministry of Health and Social Welfare, Daju Kachollom, described the digital procurement platform as a game-changing innovation that will improve efficiency, transparency, and accountability in the health sector.
So the conversation we are having today is a family conversation to discuss how, according to the objectives set by the DHS, how to strengthen service delivery by ensuring availability and affordability of essential medicines, to introduce the digitalized inventory consignment model for essential medicines in federal tertiary hospitals, to identify gaps and challenges in medicine supply chain, and to promote collaboration and stakeholders buy-in. That as we work towards this digitized inventory model for essential drugs for our federal tertiary hospitals, we need to look at where the drugs are coming in. We're trying to actually unlock the value chain by having manufacturing companies manufacture in country. Even those that are being imported, NAFDAC is working hard to be sure it is the right thing. Whatever we do, we should never forget that our job as Federal Ministry of Health and Social Welfare is to save lives, reduce both physical and financial pain, and produce health for all Nigerians.
On his part, Chief Medical Director of the University of UUTH Teaching Hospital and Chairman of the Committee of Chief Medical Directors, Professor Emem Bassey, applauded the ministry for its forward-thinking approach in ensuring essential drugs are always available for patients.
It would, first of all, allow you to know what the present situation is on ground, and would help you basically to improve your medicine availability, because at every point you have an inventory, you know what is on ground, and like you said, it would help to reduce all this expiration, because if you enter a typical teaching hospital and you see the drug store, some of them is as big as this hall with racks, you understand? So it's almost impossible without a digitalized inventory to actually keep track and know when these things are expiring. And of course, it would reduce all the stockouts and waste. And more importantly, it would help to enhance transparency.
Development partners present at the event, including representatives from the Clinton Health Access Initiative, EMGE Resources, among others, emphasized that the digital platform aligns with global best practices and will strengthen Nigeria's health supply chain management.
It's an initiative where manufacturers distributors supply products to the hospitals without collecting funds. The big deal is the CMDs do not need to worry themselves about cash outflows for medicine. And the beauty also is that you will have medicines available, no more stockouts, because the system is designed such that your pharmacy will request for the product. That's how it is. And I know those of us that we've been working together at oncology, cancer, this is just how simple it is. You don't have to worry about paying the manufacturer or the distributor. You don't have to worry about the patient not getting quality drugs. And in fact, let me say this to you, this will stamp out fake drugs.
Almost 8 years ago, Clinton Health Access Initiative, through a global partnership with some of the major pharmaceuticals, was able to get a 50% reduction in the prices of anti-cancer medication. And with the leadership of the government at the time, we started what is today called the National CAP, Chemotherapy Access Program. through which I believe a lot of what we'll be discussing today was initially conceptualized. And so for us, we're really excited to see how government took an idea to improve access to quality, safe medicines at a reduced, affordable price for Nigerian people, and we're going to be scaling this up to essential medicines for the whole country. So we're very excited to be partnering with you all, and we look forward to being able to support this initiative.
According to the ministry, this effort is part of a broader strategy under President Bola Ahmed Tinubu's health reform agenda to ensure uninterrupted access to essential medicines and accelerate progress toward universal health coverage.